So, hello mga bunso. Good day sa ating lahat. Sorry for madami excuses due to hectic schedules. Alam niyo naman kung ano ang trabaho ni ma'am, di ba? So, today, ni-record ko na lang siya for you to watch this and para ma-review din kayo mga bunso. So, once again, hello sa inyo. Kumusta na kayo? Naway, sana kakayanin niyo to hanggang sa maging RN na po kayo. So, before that, please watch this movie.
Today we're going to be performing trach care on a patient. So I have my patient chart here. Jamie Jones, MR number 589-135-1329, date of birth 1/16/62. We also want to verify that the patient has no allergies, and then we want to check the order, the physician order for the skill we're about to perform. States here, trach care suctioning every 12 hours as needed. Now we're going to go gather our supplies. We'll need a drape, suction catheter, extra pair of sterile gloves, hemostat, bandage scissors, pulse oximeter, and our trach care kit, which will have our cleaning solution, trach ties, and gauze. Now I'm going to go enter the patient's room. Knock, knock, knock. Hi, Mr. Jones. It's Sarah, your nurse. I'm here to perform trach care and suctioning. How are you today? Okay, I'm going to wash my hands. I'm going to get some gloves on here. I hear some rattling in your chest there. I think that's important that we get that gunk out of you. Just gonna bring the bed up here. Are you having any pain or anything? Okay, good. Can you tell me your name and date of birth? Okay, we have Jamie Jones, MR 589-135-1329, date of birth 1/16/62. Okay, good. Now I'm gonna just take a quick listen to you here. Take some deep breaths. Okay, and again, again, and again. All right. Sounds like we want to get some stuff cleared out of your chest there. I'm also going to put this thing on your finger here, the pulse ox. Let's see how your oxygen level's doing right now. Okay, yeah, it looks like we could use a little bit of suctioning. All right, I'm just going to get my stuff all set up. Okay, so I'm going to grab my suction catheter here from the wall. For adults, we want 100 to 120 on the suction level. For pediatrics, it's 80 to 100. And you want to make sure that the suction's actually set to continuous. Okay, so it's always applying pressure for us. Okay, now I'm going to set up my field. I'm going to take the drape, place it over Mr. Jones's chest. Put this across you, Mr. Jones, so we don't make a mess. Okay, and now I'm going to prepare my field. We want to open up the suction catheter. And now we're going to open up our trach care kit. Now remember, everything inside the trach care kit is sterile. Apply my sterile gloves. Okay, now I'm going to set up my field. So get this drape out. Remember, shiny side down. Okay, grab my suction catheter. I'm going to separate my gauze. There's two different types of gauze in here. I've got regular 4x4s and the drain sponges with the slit in it that's going to go around the trach when I'm finished. Got the trach ties. Got our normal saline solution. Packages of hydrogen peroxide, pipe cleaner, and cotton tip applicators. Okay, I'm going to open up the saline now. Doing okay there, Mr. Jones? Okay, good. I'm looking at my pulse ox. All right, I'm going to open this up. I'm going to pour 50% of the saline into the large compartment, and then the other 50% between the other two compartments. So 25 and 25 here. Okay. Then I've got my hydrogen peroxide. Open that. We're going to put that in with the 50% saline. So you're going to have a solution of 50 hydrogen peroxide, 50 saline. Okay. Now I'm going to remove the inner cannula from the patient. I'm going to keep one hand sterile and I've got one hand clean. Always want your sterile hand to be your dominant hand. I'm going to unlock the trach cannula. Okay, Mr. Jones, take some deep breaths here. I'm just removing your inner cannula. I'm going to clean it. So put that in the 50-50 solution. Okay, now we're going to let that marinate for a little bit. And I'm going to grab my suction catheter and I'm going to prepare to suction the patient. Now it's important that once I start suctioning that I'm always keeping my left hand, which is my dominant hand, sterile, and my right hand clean. Okay, I'm going to attach the two together. Okay, I want to prime my suction catheter with the normal saline. Okay, all right, Mr. Jones, I'm going to go ahead and suction you. Go ahead, take some nice deep breaths. Okay, good. I'm going to remove the trach collar, and now I'm going to go ahead and apply suction. Now, remember, we're not applying suction as we go down, but on the way back up. So I'm going to insert the catheter. I feel a little bit of resistance. I'm going to suction as I'm coming up with some circles. Okay, I want to apply the oxygen again. I'm going to clear my catheter. Okay, Mr. Jones, it sounds like we've got a little bit of secretion still in there, so we're going to suction again. Take some deep breaths for me. Okay, good. All right, here we go. Feel a little bit of resistance, then suction. Okay, reapply the oxygen. Clear our catheter. Okay, and we always want to be assessing what our secretions look like, the thickness and the color. Now I can go ahead and separate my two suction devices. Get rid of this. Now I'm going to clean the inner cannula. So remember, it's sitting here in the 50-50 solution. We're going to take the pipe cleaner and we're going to get all this gunk out of the inner cannula here. So make sure your clean hand is only holding on to this top part of the inner cannula. Okay, good. Now we're going to rinse it in the other saline solution. Okay, good. And then we want to make sure it's dry because remember, this is going back into the patient's airway. Okay, dry it off. Okay, good. Now, with my clean hand, I'm going to reinsert. Okay, And you want to make sure it locks into place there. Okay, good. All right, now I'm no longer sterile. All right, Mr. Jones. Now I'm going to continue with my trach care. We're just going to clean up around the site a little bit and change your gauze. Okay. Take the cotton tip applicator, put it in the saline solution. I'm going to remove this gauze here from around his neck. We're going to replace that eventually. Clean around the trach site. Okay, you're looking for any irritated skin, anything that might be stuck to the patient's neck. Clean that. You can take a gauze and dry it, make sure everything's still clean. Okay, good. Now we're going to change the trach ties. Now this is where it's nice to have a partner, but if not, it can be done individually. I'm going to take the tie now. Put my rail down here, get a little more comfortable. Okay, we're going to start it on this side. You want to start it on the side where the tie was, where the knot is originally. And we're going to tie it on the opposite side as the last person. Okay, match up, make sure it's equal in length. Okay, Mr. Jones, let's lift up your head here. Get this around your neck. Okay, thread it through. Okay, you never want to loosen the trach ties before you have new ties intact unless you have another person here to hold it for you. You don't want this trach to become dislodged. Okay, now I'm going to untie this side and remove the old ties. Okay, good. Lift up your head there a little bit for me. Okay, good. Now I'll apply the clean gauze. This is to catch any secretions if the patient happens to cough up on their own. There you go. All right, and then you also want to make sure that the trach ties are about 1 finger's width so that they're not too tight but tight enough to keep the trach in place. Okay, let's remove the drape. I'll reapply the oxygen. Doing okay there, Mr. Jones? Okay, good. I'm going to reassess now. Listen to my lung sounds again. Take some deep breaths for me. Okay. Again. 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 Okay, sounds much better. And then let's look at what your pulse ox is reading. Your pulse ox is much better. It's up to 97%. That's good. Okay, Mr. Jones, I'm finished with what I needed to do. Is there anything else I can get for you right now? I'm just going to clean up my area here. Put this back. Turn this off. I'm going to lower the bed. You have your call light right by you. Okay. I'll be back in about a half hour to an hour to check on you, Mr. Jones. Push your call light if you need anything.
So, yun na nga mga bunso. So, do you have an idea na kung ano yung topic natin for today? It is a highlight topic for pandemic, lalo na pag sa board exam, tungkol sa mga oxygen, suctioning, mahalaga po siya. Lalabas at lalabas po yan. So, our topic for today is all about tracheal suctioning. So, there you go. O, diba? Foci. Yeah. So, tracheostomy care and suctioning, both nasal and oropharyngeal suctioning by myself, Maria Cristina Sugitan, RNMSN. So, introduction. Besides sa mga ano ko po to sa mga tawag dyan, mga researchers, sabi, tracheostomy care and tracheal suctioning are high-risk procedures. To avoid poor outcomes, nurses who perform them, whether they're seasoned, veterans, or novices, must adhere to evidence-based guidelines. In fact, experienced nurses may overestimate their own trach care competence. So, sino bang pwedeng mag-perform po nito? Yung mga nurses like us, mga health workers na mga trained. The tracheostomy patients aren't seen only in intensive units. Hindi lang po nakikita sa mga ICU na po ito, sa mga NICU. Pwede na din po natin makita sa mga MS ward. Sa ward mismo, nakahira na pong ganitong cases din. As patients with more complex conditions are admitted to hospitals, an increasing number are being housed on general nursing units. Trach patients are at high risk for airway obstruction, impaired ventilation, and infection, as well as other lethal complications. Skilled bedside nursing care can prevent these complications. So mga bunso, alam ko ang mga tanong nyo, magiging permanent na ba siya o temporary? Usually, temporary talaga siya mga bunso. Mga temporary lang po ang trach. Hanggang sa gumaling na ang patient, kaya niya na na-decrease na yung mga excess secretions or tawag dyan, kaya niya nang makapaghinga sa kanyang sarili na without tulong ng mga oxygen supplies, ganyan. So, tinatanggal po yan. Kinakabit lang naman ng tracheostomy to malesen yung mga secretions and to reduce the risk of infection. Sabi nga dyan, di ba, airway obstruction, impaired ventilation, and infection. So, ito yung mga tatakil natin, like stoma. Yun yung gagawin sa, di ba, yung tracheostomy, bubutasan yung dito part para makahinga na maayos si patient. So, yung butas na yun ay tawag doon ay stoma, yung opening. Like sa colostomy din, di ba, pag binutasan, stoma din ang tawag, di ba? So, sabi dyan, an opening either natural or surgically created, which connects a portion of the body cavity to the outside environment. In this case, between the trachea and the anterior surface of the neck. Also, ang pinag-uusapan po kasi natin ay tracheostomy care and tracheal suctioning. Ito ang ano natin. Then yan, tracheostomy, a surgical procedure to create an opening between 2 to 3 or 3 to 4 tracheal rings into the trachea below the larynx. Ayan po yung di ba, gagawa ng butas. Ayan po yung maapektuhan ng surgery. Yung procedure kung saan ilalagay yung tubo or yung butas para makahinga ng maayos si patient. Then, tracheal suctioning. Ito na po yung ginagawa natin mga nurses. Usually kasi yung tracheostomy, doctor po yan dahil surgical procedure. Tayo naman doon tayo sa tracheal suctioning. A means of clearing thick mucus. Kumbaga, sa pagbahay, di ba, nagwawalis tayo, or usually pag social, yung vacuum. Dito naman, ito naman ang tinatawag nating vacuum sa may tracheal area. A means of clearing thick mucus and secretions from the trachea and lower airway through the application of negative pressure via a suction catheter. Meron po tayong mga gagamiting equipment. So, tracheostomy tube. At yung tube, yung kanina, yung cannula kanina, yung inner cannula, di ba? Napansin niyo yung tinanggal ni Miss Nurse kanina sa video. So, a curved hollow tube of rubber or plastic inserted into the tracheostomy stoma, the hole made in the neck and windpipe, and lower airway obstruction, facilitate mechanical ventilation or the removal of tracheal secretions. Then nasopharyngeal, pag sinabing naso, di ba, yung review natin sa ating funda. Pag sinabing naso, ilong. Pag oro, bibig, di ba? So nasopharyngeal suctioning and oropharyngeal suctioning, removal of the secretion from the oral. Pag oral, di ba, oro. Or nasal, naso, cavity, and pharynx through the suction. Kasi after natin ipa-perform ang tracheal suctioning, ine-next po kasi natin dyan ng naso and oro to lessen the secretions para ma-reduce po natin ang risk of infection and aspiration. So, what are the indications ba tayo nagsasuction? Para kanino ba itong pagsasuction? So, yan. Tracheostomy tubes may be inserted for a number of reasons like congenital anomaly. Ayan yung may problem sa larynx, sa trachea, ganyan. May mga abnormalities po dyan sa between the tawag dyan, airways, mga abnormalities through airways ng patients, hindi sila kapag makakahinga ng maayos. So, pinaperform natin ng suctioning to prevent the aspiration. Then, upper airways, foreign body that cannot be dislodged with Heimlich and basic cardiac life support maneuvers. So, yan, we tackled about the CPR, ganyan. Minsan, pag di na nagre-response si patient, ito na po yung ginagamit para makapagbigay ng better airway o better oxygen kay patient. Then supraglottic or glottic pathologic condition like infection, neoplasm, bilateral vocal cord paralysis. The neck trauma that results in severe injury to the thyroid or cricoid cartilages, hyoid bone, or great subcutaneous emphysema. Minsan kasi di ba sa mga accidents, vehicular accidents, sabi mo na lang o sa work related, minsan nagkakaroon po ng neck trauma. So, ayan din po yung way. Then facial fractures. Ayan, that may lead to upper airway obstruction. So, kailangan natin mag-suction. Kasi minsan naiipon po mga secretions dyan. Then upper airway edema from the trauma, burns, infection, or anaphylaxis. Then prophylaxis, as in preparation for extensive head and neck procedures and the convalescent period. Then severe sleep apnea not amendable continuous positive airway pressure. Usually, ito po yung mga coma, na comatose or ayun, yun na nga. Kailangan nila ng better airway. Hindi sila nakakahinga ng maayos. Then, what are the purposes of suctioning? Ba't nga ba natin ito pinaperform? To remove of the secretion from the oral cavity or nasal cavity and pharynx through the suction. Removing the secretions from the airway, facilitating the ventilation, obtaining the secretion for diagnostic purposes, then preventing the infection. Yung obtaining the secretion for diagnostic purposes, ito yung sa diagnostic ng mga bunso. Ito yung nagko-collect po tayo ng specimen para ipasa sa laboratory. So, mas ma-determine ni doc or ni physician kung anong final diagnosis ni patient. Kasi usually, ito sa apat na sinabi kong purposes, ito po ay therapeutic. Itong isa is diagnostic. Then, what are the complications of suctioning? So, may mga complications din po dyan. Like, yan, early complications like bleeding through the trauma. Di ba sabi kanina, pag yung paglalagay po ng catheter, hindi po yung tusok ka lang ng tusok, ipasok mo yung buong catheter, hindi. Pag may napansin kang resistance or yung parang dead end yan na, wag mo na itusok kasi it might be, baka magkaroon ng bleeding sa loob. Then yan, air trap around the lungs, pneumothorax, ayan nga po yung sinasabi ko, air trap in the deeper layers of the chest. Then air trap underneath the skin around the tracheostomy, damage to the swallowing tube, the injury to the nerve that moves the vocal cords. Then tracheostomy tube can be blocked by blood clots pag di po nalinisan, or like yung, kaya nga mayroon tayong tracheostomy care para alagaan po natin, para linisan natin always yung tube niya. Mahalaga po yung mga bunso kasi magkakaroon din ng complications para dyan. Then yan, later complications that may occur while the tracheostomy tube is in place include accidental removal of the tracheostomy tube. So may time na ganyan, mga estudyante. For example, aligaga, na-excite or natakot. So sobrang takot niya, hindi niya namalayan. Pagka ganun niya ng catheter, pati yung tubo, sumama. So kawawa naman si patient, no? Then infection in the trachea and around the tracheostomy tube. Pag hindi natin siya nalilinisan araw-araw, nagkakaroon po ng infection dyan. So baka mas maging complicated pa yung sakit ni patient. Then windpipe itself may become damaged for a number of reasons, including pressure from the tube, bacteria that cause infections, and form scar tissue or friction from a tube that moves too much. So kanina, di ba ito yung sinabi kanina, purposes na naman. Ayan, purposes of suctioning kanina ngayon, purposes of care. Yan, to maintain airway patency by removing mucus and encrusted secretions. Ayan, encrusted, yan yung mga blood clots, yung mga nagbuo-buong dugo na po. Then to maintain cleanliness and prevent infection at the tracheostomy site. To facilitate healing and prevent skin excoriation around the tracheostomy incision. Dito, karoon ng irritation. So, di ba nakita niyo sa video, pati ganito, pinunasan niya using the cotton swab, di ba? Then, to promote comfort din sa patient, na syempre, nakaka-relieve kaya pag nalilinisan, tapos feeling mo na may natanggal na mga dumi, ganyan. Then, to prevent displacement pain. Gaya nun, di ba, sinecure niya using something, ano yun, panali, ganun, di ba? Then, what are we going to do first? First, usually ito kasi apay na tayo eh, dahil ang diagnosis is nasa doktor. Di ba, adpay tayo. Ito, apay lang. Nasa doktor na po yung D. So, assessment, respiratory status, yan. Tignan nyo po yung kanyang paghinga, yung pagpo-fall ng kanyang baga, pag nag-inhale, exhale siya, tapos check nyo yung lung sounds niya kung may parang, di ba pag, for example, pag kayo piniplema, ganyan, di ba? O aminin, di ba? Then yan, oxygen saturation level using pulse oximeter. Tingnan natin kung 99%, 98, 98, ganyan, 96. Usually, pag nagde-desat naman niya, mapapansin nyo naman po, punong-puno siya ng secretions. Ganyan. Pulse rate, ayan, sinabi ko na kanina, secretion from the tracheostomy site. Character and amount, i-check nyo po yung kulay, ganyan. Kung gaano kadami, then presence of drainage on tracheostomy dressing or ties. Kung may blood ba yan, ganyan. Then equipment use, yung mga gagamitin po natin. Kailangan po natin ng sterile disposable tracheostomy cleaning kit. Yung parang yung ginamit ni ma'am kanina, isang buo siya, di ba, na gano'n. So pag nasa private ka, may gano'n silang ipoprovide sa'yo. Pero kung sa public, ay, ang i-ready mo dyan, na plain NSS, na 500 liters kung mayroong ganun, or Kung may 50 cc, better pa, di ba? Tapos, ano ba? Ano yung suction catheter, yung suction machine, sterile gloves. Usually, ano to, agency protocol kung sterile ba or clean gloves lang gagamitin. Then, hingi ka lang ng gauze or OF. Tapos, yung pang-drip sa patient, pag nasa public ka, hiram ka na lang sa pamilya, ganyan. Pero pag dito, for example, ito, nasa private tayo. Yan, sterile suction catheter kit, tapos sterile normal saline, ayan, check agency protocol, sabi niya, tapos sterile gloves, clean gloves, towel or drip to protect the bed linens, moisture, proof bag, commercially available tracheostomy dressing, or sterile 4 inches, ano yung gauze, sabi niya, OS, dressing, then cotton twill ties, sabi niya naman, social no cotton swab lang sa atin yan. Then clean scissors. Then yan, ito pala yung bunso, yung sinasabi ko sa inyo. Ito yung tawag dyan, yung tracheostomy tube. Ito yung tinatanggal natin sa patient, tapos binababad sa hydrogen with saline solution para matanggal yung mga crusty, encrusted blood clots, ganyan. Then ito yung nilalagay mismo sa patient sa loob para makahinga siya na maayos. Usually, doctor na po ang may procedure po niyan. Kaya pinapakita ko lang yung videos para mas maganda yung imagination nyo. Then ito po, ayan yung mga kakailanganin sa pictures. Suction catheters with tubing. Ito yung tubing. Hindi po to sterile. Ang sterile po dyan ay yung catheter mismo. Kasi papasok sa loob yan. Suction machine with gauge. Kasi with gauge po yung ating pressure. Depende po sa pasyente kung pedia, infant, or adult. Then, ang kulang kanina sa video, di ba, yung mask and eye protector. Bakit? Kasi may times talaga na bubulwak yung secretions ng patient sa mukha mo, or it's either sa damit mo, or sa kanya. Then gloves, tapos saline. Ayan. Usually, ito naman makikita nyo. Ayan, mga yan. Mga little suckers, di naman na maano yan. Hindi masyadong lumalabas yan sa alam. Then, emergency preparation starts during the shift change, safety, huddle, the formal communication between outgoing and oncoming shifts. Patients with trach tubes can call for assistance verbally. So, all staff members, including unit secretary, need to know which patients on the unit have trach tubes. Usually, nababanggit naman niya pag endorsing naman na, di ba mga bunso, nag-endorse tayo ng mga pasyente, ganyan. Then keep the following emergency equipment at the bedside of trach patients, always. The manual ventilator bag or ambu bag, 2 extra trach tubes, one of the patient's current size and a smaller one. Then an obturator of the correct size, suctioning device and catheters. Laging nasa bedside po to pag ang patient mo ay may tracheostomy or tracheostomy tube. Tracheal tube, mga ganyan. Yan ang maririnig nyo. So ito, procedure, identify the patient, then determine the need for suctioning, verify the suction order in the patient's chart. For post-operative patient, administer pain medication as prescribed before suctioning. Bakit? Ang rationality to ensure that client receive the right intervention. Right patient, right intervention, right? Ay, verify nyo muna. Di ba nabasa mo na yung chart? So, nakita mo yung physician order. Kunwari, Miss Marites, for suctioning every 12 hours, PRN. Ano ibig sabihin ng PRN? Sabi sa funda, as needed. So, napansin mo si Aling Marites ay masyadong maplema. Narinig mo yung kanyang lungs. Malayo ko lang. So, ganun na. So, ibig sabihin, kailangan mo na mag-suction. So, na-verify mo na. So, lalapit ka na kay Aling Marites. Magandang araw po, magandang gabi, magandang hapon po. Ako po si Tina, ang nurse po nyo. Ang nurse po ninyo ngayon, pwede ko po bang i-verify kung kayo po ba si Aling Marites? Pag umoo, i-check nyo yung ID band. Kailan po yung birthday? Pag verify nyo, pag nakita nyo na tumango siya, ibig sabihin siya nga. Then, syempre mapapansin nyo, di ba meron siyang tracheostomy dito. So, next natin is, explain to the patient what are you going to do and the reason, even if the patient does not appear to be alert. They assure patient you will interrupt procedure if he or she indicates respiratory difficulty. Pag conscious si patient, i-explain nyo, tatango naman siya tatango yan. I-explain nyo kung anong gagawin nyo. Kailangan po namin kayo mag-suction para mabawasan po yung plema po ninyo at makahinga po kayo na maayos. Pag kailangan po umupo lang po, wala pong problema. Iyon, ganyan. Then pag unconscious si patient, magpaalam na lang kayo sa family. At least, aware sila na nag-suction kayo. Ayan, sabi nga sa rational, reduce fear anxiety, then elicits cooperation para magpag-cooperate din si patient. Then after that, after mo na provide privacy, then perform hand hygiene, then adjust bed to comfortable working position. Usually, yan, semi-Fowler si patient. Hindi po supine, ha? Then yan, lower side rail to closer to you if patient's conscious. Place him or her in a semi-Fowler position. If patient's unconscious, place him or her in lateral, not supine. Bakit? Kasi may tendency po na ma-aspirate si patient. Then adjusting the bed, sabi nga sa rationale, adjusting the bed at working height reduces, promotes proper body mechanics para hindi ka din mahirapan, then reduces back strain. These positions facilitate insertion of catheter. Then, place a towel or waterproof pad across the patient's chest to prevent secretions from getting into the patient's gown, sabi niya. Kailangan po yan kasi may tendency po talaga na pag umubo na si patient, di ba pagkatanggal mo ng tube, uubo si patient, may tendency po na bubulwak, magkakalat ng kanyang plema. Kaya nga natin pine-perform, di ba to? So yan. Turn suction to appropriate pressure. Pag adult po ang ating pasyente, usually 100 to 150 po ang pressure niya. Remember that, mga bunso. Then neonates, 60 to 80. Neonates, mga bunso, 60 to 80. Yan yung bagong labas na mga baby, ha? Bagong panganak na baby. Pag infants na kasi may buwan na po yan. 80 to 100 pag infants. 80 to 100. Children, 100 to 120. Bakit may mga ganyan po yan? Kasi yan po yung lakas ng paghigop ng suction. Pag nilagay mo 100 to 150 doon sa neonate, Diyos ko, lahat ng lamang loob, baka nasup-sup mo na, no? So, common sense lang yung mga bunso. Ayan, always remember that, ha? Then, usually, ito naman sinusundan natin yung 100 to 150. Unlike do sa portable unit, ito pong uso yung wall unit. Then, yung portable unit, siguro pag emergency cases, yan, adult daw 10 to 15. Pag neonate, 6 to 8. Infant, 8 to 10. Children, 10 to 12. Parang tanggal lang tayo ng isang zero, right? Yan. Then, sabi dito, put on disposable or clean glove and occlude the end of the connecting tubing to check suction pressure. Place the connecting tubing in a convenient location. If using it, place resuscitation bag connected to oxygen within convenient reach, sabi niya. So, ano nga bang rationale? Sabi, applying appropriate suction prevents trauma to the mucous membranes and tissue. Kailangan talaga kontrolin natin yung pressure po, ha? To prevent trauma. Then, open stir suction package using aseptic technique. Ano naman aseptic technique, mga bunso? Gagamit tayo ng sterile po dito, no? Sterile na gloves. pag kukunin ng ating suction catheter, di ba? Open natin. Ang pagsuot po ng ating sterile gloves ay sa dominant hand dahil yun po ang ating useful na hand. Then sa non-dominant is clean. Depende po sa agency policy. So always magtanong pag hindi alam mga bunso. So yan, open sterile suction package using aseptic technique. The open wrapper or container becomes a sterile field to hold other supplies. Carefully remove the sterile container, touching only the outside surface. Set it up on the work surface and pour sterile saline into it. So nakita nyo, di ba, kung paano mag-pour po ng sterile saline si ma'am kanina sa video. At least, binigyan ko kayo ng introduction sa video para ma-imagine nyo or mag-flashback sa isip nyo. Bakit natin pinaperform aseptic technique? 2, asepsis is vital to prevent complications, sabi. So yan, kita nyo yan, may OS or gauze dito, tapos may support pa, yung tali. Then ito, nakakonect yung line, di ba? Nakakonect po sa, ito NGT to eh. Ito, nakakonect po siya sa mechanical vent. O anong ibig sabihin niya? Oxygen support. Oh, sabi dito, put on face shield. Ayun yung sinasabi ko nina, di ba yan yung kulang ni ma'am? Wala siyang face shield pero nakasalamin siya, tsaka wala siyang mask. So, put on sterile gloves. The dominant hand will manipulate the catheter dahil siya ang naka-sterile gloves. Then, must remain sterile, sabi niya. As the dominant hand is considered clean rather than sterile and will control the suction valve on the catheter. For infection control purposes po yan mga bunso. Yan. Iniiwasan po natin ang cross-contamination. Sabi pa dito, with dominant glove hand, pick up sterile catheter, pick up the connecting tubing with the non-dominant hand and connect the tubing and suction catheter. Then moisten the catheter by dipping it into the container of sterile saline unless it is a silicone catheter. Occlude white tube to check suction, ensures functionality of the equipment. Ibig sabihin po niyan, di ba na-connect na po natin si suction catheter do sa tubing. Na-connect pa. Na-connect natin. Ito yung tubing. Nasa non-sterile po ako kunwari. Non-sterile. Non-sterile. Hawak ko si tubing. Ito si suction catheter. Sterile. I-connect ko sila. Then yan. Pag na-connect na, ay dito pa. Diba, na-connect na. So, itatry naman natin siya nagsa-suction. Di ba, ilalagay mo na siya sa adult. For example, adult. 120, ba? Sabi niya, or 100, 150. Ayan, 100, 150. Ilagay ko na yung pressure sa 100, 150. Then, ididip ko yung catheter do sa sterile saline. Pag ginanyan mo kasi yan, nagsa-suction, ibig sabihin, makakarinig ka ng parang gano'n. Yung parang sa video kanina, di ba? Pag pinindot mo kasi yun, magsa-suction na yun. Pero pag naka-open, wala. So yun, dinip mo na siya. Tapos, unti-unti mo siya gano'n. Pag nakapag-suction naman siya ng sterile, na kahit konti, ibig sabihin, nagpa-function siya. Then next, using your non-dominant hand and a manual resuscitation bag, ayan, ambu bag, if hyperventilate mo si patient, tatanggalin mo na mo yung oxygen niya, then ikakabit mo yung ambu bag, mag-deliver ka daw ng 3 to 6 breaths. Usually 3 lang. 1, 2, 3, then remove the ambu bag. Kailangan i-ano mo siya, di ba? Sabi dito, hyperoxygenating the patient prevents hypoxia and hypoxemia. O nakapagbigay na tayo ng 3. 1, 2, 3, then remove. Then, next, open the adapter of the mechanical ventilator tubing or remove oxygen delivery setup with your non-dominant hand. Tatanggalin mo siya using your non-dominant hand. Sabi dito, maintains asepsis and infection control nga. Then, using your using your dominant hand, di ba ito yung dominant hand, hawak mo yung suction catheter. Gently, and quickly, hindi yung ganun agad. Quickly, na may pagkasamang gentle, ganyan. Pasok mo yung suction catheter, tapos pag napansin nyo na may resistance na, huwag nyo na pilitin ipasok. Ibig sabihin na nasa tama ka na. So, ilalabas mo siya. Hindi yung pagpapasok yung suction catheter, doon ka magsa-suction. Ipasok mo muna, then by using rotating process, doon ka na mag-suction habang papalabas. O, pag lumabas na, ibalik mo ulit yung kanyang, kung ang bubag ang gamit, ibalik mo na. Tapos mag-hyperoxygenate ka. Habang nag-hyperoxygenate ka, magpa-flush ka na using the saline solution para ma-flush yung mga nasuction mo dun sa may catheter. Kailangan i-check mo kung may dugo nga ba o maplema, may kulay, green or yellow. Kailangan manood mo siya mga bunso. Then, pansin mo, umuubo pa si patient. Feeling mo may lumalabas pa ng mga plema. So, kailangan mo siya ulit i-suction. So, nakapag-deliver ka ng tatlong pump sa patient, nag-hyperoxygenate ka. Tanggalin mo, then ipasok mo ulit, then by using rotating, ganyan, 1, 2, 3. Kasi sabi dito, do not suction for more than 10 to 15 seconds. So, magbibilang ka niya mga bunso. Yan. Lalabas siya. Then, paglabas, ibalik mo ulit yung kanyang oxygen support, tapos isaw-saw mo na. Pag napansin mo nang wala ng mga parang gano'n, huwag ka na mag-suction dahil ibig sabihin clear na siya. So, yan, habang pumapasok yan, na-flush mo na. I-assess mo ulit kung ano yung mga lumabas, no? Sabi nga sa rationale, intermittent suction prevents trauma to tissues. Sabi nga niya. Gentle rotation of the catheter ensures that all surfaces para wala kang makaligtaan. Then, are rich and prevents trauma to any one of area the respiratory mucosa due to prolonged suction. Then, applying suction for too long may cause secretions to increase or decrease the client's oxygen supply. So, kailangan may time po tayo dyan para hindi mag-hypoxia si patient. Then yan, hyperventilate the patient using your non-dominant hand. Ayun yung sinabi ko kanina. Yan, to hyperoxygenating the patient prevents hypoxia and hypoxemia. Sabi niya, di ba? Tapos flash catheter with saline. Ayan, didiretso ko na kanina. Assess effectiveness of suctioning and repeat as needed and according to patient's tolerance. Minsan kasi may patient na napapansin ka lumulha kasi masakit po yan. So wrap the suction catheter around your non-dominant hand between attempts. Usually kasi ang paggamit po ng suction catheter, for example, ito siya. Ginaganyan kasi yan bago natin ipasok sa loob ni patient. No? Para hindi magdangling. Kumbaga kasi po nagdangling yan, baka matouch yan kung ano, hindi na siya scary. Baka makapagbigay pa ng infection kay patient. Ano, sabi dito. Coiling the catheter facilitates easier grip and control while doing the procedure. Sabi niya. Then, allow at least a 30-second to 1 minute interval. If additional suction is needed, no more than 3 suction passes. Sabi niya. Hindi daw lalagpas ng 3 suctioning process. Dapat mga 2 to 3, pwede na siguro yun. Then, suction passes should be made per suctioning episode. Encourage patient to cough and deep breathe between suctionings para hindi siya mag-hypoxemia or hypoxia. Then, suction the oropharynx after suctioning the trachea. Nilagay, di ba, tapos ka na sa trachea. Ngayon, magpa-flush ka muna bago mo i-suction ang naso and oro. Huwag yung kakalimutan yung bunso. Tapos na kayo nag-suction sa trachea, huwag yung kakalimutan ang naso and oro. Baka meron din pong secretions kasi dyan. Then, do not reinsert in the tracheostomy after suctioning the mouth. Pag nagamit mo na sa ilong tsaka sa bibig, huwag mo na ibabalik sa dito. Ibig sabihin, i-discard mo na. Kumbaga, ito na ang last mo. So yan, sabi sa rationale, continuous suctioning may cause trauma and hypoxia. Yan. When suctioning is completed, remove glove from dominant hand over the coiled catheter, pulling it off inside out. Remove glove from non-dominant hand and dispose of gloves, catheter, and container with solution in the appropriate receptacle. Remove face shield or goggles and mask. Perform hand hygiene. Tapos anong sabi sa ating for infection control? Sabi niya. Then turn off suction. Assist patient to a comfortable position. Raise bed rails. Offer oral hygiene after suctioning. Sabi niya. Secure safety of the patient as well as oral hygiene promotes comfort to the patient or client. Then reassess patient's respiratory status including respiratory rate, effort, oxygen saturation, and lung sounds. To evaluate effectiveness of the procedure kung talagang nakatanggal po tayo ng secretion. Diba kasi tusok tayo ng tusok. Sabi sa iba, nagdugal ka la dugal. Sabi niya. Yun naman pala, hindi natin nagawa ng tama. So, kailangan ma-evaluate din natin yung mga punso. Di ba? Lahat naman nagdadaan, adpay niya, di ba? Assess, ganyan. Assessment, diagnosis, planning, implementation, evaluation, di ba? So, same with oropharyngeal nasopharyngeal. Ganun at ganun. Hindi ipapasada ko na lang itong mga bunso kasi same at same pa rin po yan. Yan. Parehong-pareho siya mga bunso. So, after that, documentation. For example, ngayon, or yan date, di ba, October 11, 2021. Dahil next shift na nga, 8 ang next shift. So, 7:30 a.m., sabi mo dun sa yung chart, lung sounds clear. Wala ka nang naririnig na mga plema or ganun, di ba? Then, able to expectorate secretions requiring little suctioning. Ayan yung habang nagka-cough siya, ayan yung tinatawag expectorate, yung mga maflema, ganyan. Then, requiring little suctioning. Then, large number of thick secretions cleanse from inner cannula. Then inner cannula change, trach dressing change, skin around trach is intact but slightly red in color, 0.2 cm around, entire opening kung gaano kalaki. Tapos no broken skin noted in the reddened area. So, isasay mo na siya dahil ikaw ang nagbigay ng care and suctioning sa patient, ikaw ang pipirma. So, ganun kadali lang mga bunso. Madali lang talaga siya gawin bunso, pero yun nga, always remember yung pressure. Baka mamaya sa bata, nagawa niya ng 100 to 150, baka nagkaroon na ng trauma sa loob, no? So, alalahanin niyo lagi yung mga pressure, yung mga ating catheter, may mga sizes po tayo nun. Then, always assess nga, before and after. Before, during, and after the procedure. So, kung hindi pa kayo natin, so yan na nga yung last natin bunso. Sana kahit ganito nga lang virtual or ni-record ko lang, maintindihan nyo yung ating lesson. Pag may tanong, itanong nyo po ako. Huwag po kayong mahiya. Pag may problema, i-chat nyo lang ako. Di po ako magagalit. Pero pagdating sa pera, wala akong may tutulong. Kasi pare-pareho tayo naghihirap ngayong pandemya. Kumikita lang po tayo na pera. Yan. So, hopefully may naintindihan kayo and naway nasa safe kayong area and soon to be RNs. Yan. Thank you so much sa inyong pagkikinig. And I will upload this para ma-browse nyo din para makita nyo and pwede nyo balik-balikan pag di nyo talaga siya naintindihan. I-chat nyo lang ako So, yun lang. Good day ulit. Ingat kayong lahat and God bless.